Hello, I'm going to talk about extracorporeal membrane oxygenation for severe acute respiratory distress syndrome. It's a short-term and special procedure performed to critically ill patients who have an acute and severe cardiac and/or respiratory failure that is reversible when patients have no response to all conventional treatments and therapies.
VA ECMO is often performed using centrally placed cannulas, meaning that the cannulas are placed in the great vessels in close proximity to the heart. This animation shows highly oxygenated blood from the ECMO circuit being returned to the patient through an arterial cannula placed in the patient's ascending aorta. With extreme cardiac dysfunction on ECMO support, if the heart is not beating and the aortic valve is not opening, blood being pumped through this cannula provides 100% of the patient's blood flow. In this scenario, there's no mixing of the two circulations since no circulatory support is being provided by the native heart. However, as the heart recovers and begins to beat, the aortic valve opens and blood flow from the native circulation now mixes with blood exiting the centrally placed arterial cannula. The composition of the blood distal to that mixing cloud will depend on the relative outputs of each of the two circulatory systems. In this scenario, blood sampled from most regions of the body would generally have a similar composition. The exception may be the coronary arteries, which, due to their proximal takeoff from the ascending aorta, may be primarily perfused by blood exiting the left ventricle, and not by blood leaving the ECMO cannula. The perfusion of coronary arteries with adequately oxygenated blood can be problematic during VA ECMO support, even with centrally placed cannulas. Care should be taken to adequately oxygenate blood traversing the aortic valve if the lungs are capable.
Application in medicine. ECMO technique was an adaptation of conventional cardiopulmonary bypass technique and introduced into treatment of severe acute respiratory distress syndrome in the 1970s. Pros and cons. It can really be a game changer for patients with breathing problems through its effectiveness in being analyzed, more complex and expensive than regular ventilation.
A WikiVidi Documentaries production. Don't forget to like and subscribe. Enjoy. Extracorporeal membrane oxygenation. Extracorporeal membrane oxygenation, also known as extracorporeal life support, is an extracorporeal technique of providing prolonged cardiac and respiratory support to persons whose heart and lungs are unable to provide an adequate amount of gas exchange or perfusion to sustain life. The technology for ECMO is largely derived from cardiopulmonary bypass, which provides shorter-term support. This intervention has mostly been used on children, but it is seeing more use in adults with cardiac and respiratory failure. ECMO works by removing blood from the person's body and artificially removing the carbon dioxide and oxygenating red blood cells. Generally, it is used either post-cardiopulmonary bypass or in late-stage treatment of a person with profound heart and or lung failure, although it is now seeing use as a treatment for cardiac arrest in certain centers, allowing for treatment of the underlying cause of arrest while circulation and oxygenation are supported. Medical uses. Guidelines that describe the indications and practice of ECMO are published by the Extracorporeal Life Support Organization. Criteria for the initiation of ECMO vary by institution, but generally include acute severe cardiac or pulmonary failure that is potentially reversible and unresponsive to conventional management. Examples of clinical situations that may prompt the initiation of ECMO include the following. Blood. Heparin-induced thrombocytopenia is increasingly common among people when HIT is suspected. The heparin infusion is usually by a non-heparin anticoagulant. There is retrograde blood flow in the descending aorta whenever the femoral artery and vein are used for VA ECMO. Stasis of the blood can occur if left output is not maintained, which may result in thrombosis. Mechanical ventilation. The CESAR study has shown an improvement in 6-month survival without severe disability in patients versus conventional ventilation in ARDS. Bridge to assist device. In VA ECMO, those whose cardiac function does not recover sufficiently to be weaned from ECMO may be bridged to a ventricular assist device or transplant. A variety of complications can occur during cannulation, including perforation with bleeding, arterial dissection, distal ischemia, and incorrect location, but these events occur highly infrequently. Research. A 2014 study showed that a factors IEA inhibitory antibody provides thromboprotection in extracorporeal circulation without increasing bleeding risk. Experiments on neonatal animals showed that ECMO treatment can lead to apoptosis of enterocytes, damage of the intestinal mucosal barrier, and bacterial translocation. This might explain greater severity of systemic inflammatory response in neonates. ECMO has also seen its use on cadavers as being able to viability rate of transplanted organs. Brought to you by WikiVidi Documentaries.
Issue of bleeding in Ecuador. In adult patients with ARDS, 2 randomized controlled trials published in 1979 and 1994 failed to show an advantage of ECM over conventional treatment. Survival rates were only 10% and 33% respectively in the ECM groups.
Saving a life is no easy task. Options for treatment vary based on the severity of injury, the prior health of the patient, the experience of the medical team, and the resources available within the hospital. For over 60 years, doctors relied on ventilators to supply oxygen and remove carbon dioxide when a patient's lungs or respiratory system fail. Ventilators oxygenate the body by forcing air into the lungs through a tube inserted into the trachea. As the ventilator pumps air into the body, the lungs inflate to mimic the process of breathing. When the ventilator finishes delivering a breath and the airway pressure drops, air is exhaled from the body and the lungs deflate. While this mechanical imitation of breathing can achieve the same goals as spontaneous breathing, it is not natural to our bodies and has its own side effects, especially at high pressures and oxygen concentrations. Although doctors don't exactly know at what settings a ventilator's side effects start to cause lung damage, they do know that an alternative treatment called ECMO can reduce injury caused by ventilators and foster lung healing in certain types of diseases. ECMO stands for Extracorporeal Membrane Oxygenation, and it can carry out the work of a patient's lungs, heart, or entire cardiorespiratory system following trauma, infection, or surgery. It works by removing blood from the patient's body, pumping it through an artificial lung where it receives high concentrations of oxygen, and carbon dioxide is removed before returning it back to the body. This technology sounds simple in concept. However, it is actually an intricate system that requires a team of specialists to watch over an ECMO response 24 hours per day, sometimes for several weeks. As with most life-saving techniques, ECMO and ventilators each come with pros and cons. Mechanical ventilation is a quicker method for oxygenating a patient. Standard ventilation requires less monitoring than ECMO, but it does come with moderate to heavy sedation and can cause lung injury at high pressures or oxygen concentrations. ECMO allows patients to be awake and moving during their treatment. By eliminating the breathing tube and ventilator, it removes a substantial irritation that drives the need for sedation. ECMO is not without its risks, but these have become more manageable in specialized centers. Texas Children's Hospital is fortunate to have on-site ECMO capabilities, with both the equipment and experienced staff to help a patient who needs assisted breathing, but can't take the strain of being on a ventilator. Texas Children's is an internationally recognized center of excellence for ECMO, with advanced experience in this field. For more information, go to texaschildrens.org.
ECMO technology as well as conventional treatment of adult hearts have undergone further improvements. In conventional treatment, lung protective ventilation strategies were introduced and ECMO was made safer by applying every code, equipment, membranes, and tubings.
28, she was pursuing her dream when she began to feel achy pain, a pain she simply ignored.
At first it's joint pain, but then it progressed to nausea and eventually coughing up blood.
Heather became sick, very sick. She was taken to a local hospital where doctors said her lungs were shutting down. She was transported to MedStar Washington Hospital Center, one of the few hospitals in the region equipped with a medical device called ECMO.
It's basically a pump that can support the function of the lungs or the lungs and the heart.
ECMO, or extracorporeal membrane oxygenation, provides that support to patients whose heart and lungs cannot normally function on their own. The machine circulates blood from the person's body and artificially removes the carbon dioxide, which oxygenates the red blood cells and keeps the patient alive while healing.
But in itself, it's not a cure, so it's a sort of a support that allows us to replace the function of the heart and the function of the lung for the time being, and in the meantime, hope that those two systems are going to heal.
In Heather's case, she was dying. Her lungs were filled with blood, and then her heart stopped. ECMO was her lifeline.
We knew that we had to put her on ECMO as soon as possible before she had any significant damage to her brain.
Some patients remain in the intensive care unit on ECMO for a couple of weeks. Heather's body began to respond, and she was taken off ECMO therapy after 8 days. Diagnosed with a rare autoimmune disease, Heather's recovering and is on chemotherapy and other medications to fight her condition. She knows this life-saving technology saved her life.
I've been told several times that if this had happened to me anywhere else, I would not have made it.
Ay, espero que no haya salido tu voz.